Misty from Bryant writes, my husband wants to keep working part-time after retirement, mostly for the health insurance. Is that really the best reason to keep working? If you're not working, or if you aren't working just for the benefits, it might be costing you more than you think. So let's talk about that. The short answer here, I don't think that it is the best reason to keep working, but it is a reason. What you really need to do here is a cost comparison of the health insurance you have now, and maybe you have done this, Misty, a cost comparison of the health insurance you have now versus what you'd be able to get in the marketplace. And that needs to be more than just the premiums you have to pay, because you're going to really have to do an analysis of the types of coverage that you're going to deal with, because it may look good to keep working, but you do have to pay the premiums, and potentially your plan might not be as good. But generally speaking, if you go to the marketplace, premium's going to be higher. The overall plan's probably not going to be as comprehensive.
Yeah, I mean, when you realize that your employer is probably paying 75% of your premium right now, I mean, that's a good just rule of thumb before you even go start shopping what's out there, is to go, okay, if I'm paying 25% of it, even if my policy benefits stayed the same, but I had to quadruple the premiums that I'm paying and I don't have my working income anymore, can I do that? And again, that's just an initial starting point before you delve into it with more research.
Yeah, and I think if you have any pre-existing conditions, that's a piece to that too, to really look at and know if you have some ongoing chronic health costs that are associated with that. But I think it kind of comes back to what we talk about often on this show, is making that decision in a vacuum is not really the best way to do any financial decision. I think if you listen to our show very often, you get that gist. We want to take a look at the overall plan. So do you have one, Misty? And does your husband have one? If you build a retirement income plan, which incorporates your guaranteed income sources like Social Security and creates an investment and withdrawal strategy for your assets to be placed on a monthly income on top of that Social Security, you'll have an expectation of what you will have in income and be able to match that to your expenses and discretionary spending in retirement. And that would give you a really good idea of what kind of premium increase you could potentially afford if your husband really does want to keep or to not keep working and be able to step into retirement and is only staying there because of the health insurance.
So think about, through all these cost conversations, how much out-of-pocket cost can you afford? And and don't look at, can we afford what we did last year? You really need to understand what you can cover out of pocket, because what you did last year might be less than what you're going to need in retirement. Just keep in mind, the older we get, the more reasons we have to go to the doctor in many cases. So be sure that you're thinking through that, and whether or not you have an HSA or significant cash savings. And if you have an HSA and you're not using it yet, then maybe, Misty, between now and retirement, if he's going to continue to work, maybe that's something that he can fund a little bit over the years and just put some cushion in that and or additional savings. So, and for those who are listening, this wasn't your question, but you're listening to this going, hey, that might be something I need to pay attention to. Get started on an HSA if you have access to that, because it can be very beneficial to you in retirement to help you on these health costs.
That's a great piece of this question that we don't have the answer to. We don't know how old anyone is in this question, in this equation. Now, it is pretty likely that if the husband is thinking about that, he's probably getting close to retirement. But I think this is part of it. That plan that we talked about for retirement income can also help you determine that if you need to keep working full-time. You're asking about going part-time just to keep the insurance, but will you lose access to a defined contribution plan through your employer, like a 401k? If you go part-time and you're no longer eligible for that, you're not going to be able to continue to add savings, and you might need to do that if you are behind on your trek for financial independence. So you may be able to do that for a short time, maybe to age 65 for Medicare eligibility. But the reasons that we get, kind of veering back into this, was taking this question and applying it to other listeners, the main reason for this typically is oftentimes not really the worker that is shy of age 65 and Medicare eligibility. But Janet, oftentimes it's a spouse that is younger and they need the coverage.
You're absolutely on point, and that's definitely a reason to consider continuing to work if you can't accommodate it otherwise. But I would say one other thing about this part-time consideration, and I feel like Misty and her husband have probably already checked into this just because of the way this is phrased, but just a warning for everybody out there that there is a part-time level where your health insurance benefits would still be available, but you can go so part-time, so few hours, that benefits no longer apply to you. So be sure before you start pulling the trigger on something like this that you've checked with your employer specifically to know that those benefits would continue with the reduced hours at the level that you're considering reducing them.
Let's throw one more consideration in there too, because again, when we get a two-sentence question, we don't know what they don't know, or we don't know what they do know. Misty's asking this, saying, hey, he's going to work mostly for the health insurance. I don't want to completely assume that that's just about stepping into the marketplace and having to pay more premium. If that's not really the piece to it, and maybe it is he likes his coverage, there is a thing called COBRA, right? If Misty's husband is 63, 64, really closing in on 65 and just trying to cover a small gap between where he is now and where he will be when he is eligible for Medicare, there is an option for COBRA, which basically means he can pay more. He can pay the employer side of the health insurance premium, but still get the same plan. So if it's because you really like your plan and that's why you want to continue to work to keep that health insurance plan, that's something you can look into too, especially because usually the windows are 18 months, 12 to 18 months, that they can, the employer will allow you to keep that coverage and be able to coast into Medicare eligibility that way.
Yeah, Misty, I think we may have more questions for you than you had for us, but I do think it's all about doing your research, and we have a health insurance guru we can put you in touch with. Not on the team, but we can make the connection.
Yeah, I wanted to mention earlier, too, as you hear the final bell, we've got to get into our final thoughts, but we were talking about insurance like long-term care and disability. We do have a team member for that.
In-house, absolutely. And I'll just go ahead and make that my final thought. We have on the team Jason Marshall, whom we've known for a good many years now, and he was a great friend of Gen Wealth before he was a team member, and he comes to us with significant background in the insurance realm. And I just feel like when we look at Discover, Protect, and Share True Financial Independence, which is our purpose for breathing oxygen on the planet at Gen Wealth, that's why we're here. When you look at that protect element, I think a lot of people just don't check the box on insurance. If it's early in life, they don't check the box on getting enough coverage if something happens to them while they're young and they have a spouse and young kids. And later in the life, many times they don't check the box on addressing the long-term care. So we've got somebody in-house to take care of that for you and help you answer those questions.
And I'll build off of that, too, for my final thought. We are always going to check the box on the financial planning side for those things.
Yes.
But oftentimes when we onboard a client and we're working with their retirement plan and all of the complicated nature of that, and when they have to absorb all of that and make the decision to move their accounts and begin a relationship as a Gen Wealth client, they can easily put that on the back burner.
Yeah.
They can easily put that insurance thing on the back burner. So come back to it. Get Jason involved after that. It's part of the process, but it needs to be broken up for sure and taken in bite-sized bites there. If you, I don't know if that makes
bite-sized
sense.
Pieces.
Bite-sized pieces. There we go.
I got you.
I know I'm running out of time, so that's why. We are out of time for this week's Get Ready for the Future show. Want to encourage you to get your questions in by texting or calling and leaving a voicemail to 501-381-5228. We want to hear from you. Anything about money, investments, retirement, Social Security. Get your questions in and hear it on the air when you join us again next week. We'll see you then.